Apologies for the delayed start, but thank you anyway for being patient with us. Those of you who are listening via RTC, those of you who are with us via Facebook, thank you for joining us. To the media, thank you for being here. We know it's a very eventful day in the Turks and Caicos Islands, so we appreciate your presence here with us today. First today, risk reduction strategy for the Turks and Caicos Islands. Along with him is also Dr. Nadia Astwood, who is
Thank you very much. And it's almost so fitting. Press introduce it to the Turks and Caicos Islands when most people wasn't. After a long that and join, and suddenly we will continue. Never stop, and today we have the Chief Medical Officer here and Chief Environmental Health Officer, two of the team leaders, section leaders. And that has been put in place wouldn't be there. And they have been working wonderfully for the people of here in the Turks and Caicos Islands. We want to keep the press conference short. I want you to more hear from the technical persons inside the ministry and whatever questions you have that I may not be able to fully add enough. So I just think that on this day of reopening, you need to hear from the technical team, more the technical staff in the ministry. The country. It will never be a perfect day. We can say, well, if we'll delay until September. What if September we see an increase in cases the day before we open? Will we say then we have to delay until November? And then when we reach to November, suppose we had some resurgence in cases in November. What will we say then? We have to wait until January, February? Imagine how that will impact families here in the Turks and Caicos Islands. If we keep on pushing back the date, keep on waiting and waiting. So we have to go and look at how best can we survive, how best can we live, how best can we cope with COVID-19 now. What measures can we put in place? What mitigating measures can be put in place to minimize the risks? Like I said, everything, there's a risk. There's a risk in everything. We have a speed limit. Speed limit on the highway on some roads is 40. And seatbelt laws are in place. But that means that an accident cannot happen when you're knocking 20 miles an hour? Or does that mean that if you go over 40, you will definitely have an accident? I can knock 5 miles an hour and get in an accident. So measures are put in place, and it's calculated that how best we can reduce the risk. Just like the speed limit, in certain areas, the technical persons come up and say, well, for this road, in order to reduce the risk of an accident, this road should be only 15 miles an hour. Well, this road is straight and long and open. This road should be probably about 40 miles an hour. So what the measures that we have put in place to minimize our risk here in the Turks and Caicos Islands? We said, well, if we're going to reopen, we want everyone coming to the Turks and Caicos Islands to have a COVID-19 PCR test. That is one of the measures that we put in place. We look at first, okay, can we get it in 24 hours? That is most ideal. 24 hours and come. That is unrealistic and unattainable. Then we say, well, 3 days, 72 hours. We check, can anyone in our country or the countries of where our visitors really originate from, can they get it in 72 hours? Maybe in the next couple of months they can, but right now they cannot get it in 72 hours. So some countries move to 10 days, but we're saying 10 days is, we felt that there's no point in 10 days. Way too much can happen in 10 days. Each day out, you're increasing your risk. So the most farthest we were willing to go to is 5 days. So we said, okay, we have to, okay, and we did the chart. 1 day, your risk level is this amount. 2 days, your risk level is here. 3, 4, 5. And we settle on 5. We are hearing that maybe 5 may be difficult now, but we cannot keep on pushing it back before we reopen. So we feel that 5 days is good. Now what that means that everyone on that flight, you can feel assured that they have had a COVID-19 negative test before coming into the country within 5 days. So it doesn't say that when on their way to the airport, someone will cough on them, or they take down their mask on their way, and that same moment when they take down their mask, someone cough on them. There's always a risk, but it's decreasing the risk as much as possible. So we have those persons coming on the flight, COVID-19 negative, at least tested within those 5 days. Wearing their mask also, social distancing. So that is 3 measures and areas that we put in place to minimize the virus. Now while they're here, we have all the health protocols through the airport. And also, if for some reason that person is COVID-19 positive and didn't show up, for some reason that when they did their test, it didn't pick up or anything like that, we have all the social distancing and mask wearing protocols in place. So if persons adhere to that, the virus will not pass from one person to the next. It's all about reducing risk and reducing transmission. Same thing, in the same breath, I want to urge the people in the Turks and Caicos Islands to let's stick to the protocols. We have seen during the first phase of this pandemic that we did good and we stopped the spread of this virus. Everyone adhered to the protocols. Now, let's do it again, and let's do it even to a higher phase now that we have guests coming into our country. To see the amount of face shields and mask wearing that I now see in place. And I want to urge us not to let that one rogue person destroy it for all of us. We all are doing wonderful. Let's stick to the protocols. Mask wearing, social distancing, your hand sanitizing the substances. We will be okay. We will be okay if we follow the protocols. Just like how if you drive at the speed limit and put on your seatbelts, if there's an accident, you will be okay. If Turks and Caicos Islands, if we follow these protocols from the Ministry of Health, from the government, things will be okay. We cannot keep on putting off the date. There will never be a perfect date. But with the protocols in place, that they are followed, things will be okay. And I want to remind businesses that as inspections are taking place, get your business inspected, show the department your protocols, show what you have in place. We have that compliance team that is going around that will be checking businesses. We want to add to that, we created about 11 jobs for some people who are unemployed. So we're increasing jobs at this time. So with COVID, even though a takeaway is also given. So we have given some persons jobs to join that team. Is being led by the Environmental Health Department. They will be going around checking businesses to make sure that you're adhering to the social distance measures and the protocols that have been established. So I just want to leave and saying again, There will be never a perfect time to open. Now as best time that we have. There is a balance, and we have to balance lives and livelihoods. We cannot keep the country closed. We cannot be closed forever. But when we open, we have to open in a very smart and scientific way. And I believe that what we have done is the best that we can do at this time. We have seen the mistakes of other countries, and we have learned from them. So we know some of the do's and don'ts from other countries, and we want to make sure that it doesn't take place here. Persons ask about why don't we test when the persons come in. Well, we want to stop the virus from coming to our shores first. We don't want the virus to come and then fight it. That can be a measure later, when the science is more advanced and we can test faster and the equipment is there where we can just do a finger prick and can tell if you have the virus, then we can employ those things. So we'll be keeping up with the science. And as the science change, our methodologies at the airports and bringing in guests will change with those methodologies. So again, thank you, but I want you to hear from the technical team and answer any questions from them. Thank you very much.
Thank you, Minister, and good morning, everyone. Activities and is now transitioned to ensuring that the ports have in place the relevant measures in response of the reopening of the borders today, 22nd of July, 2020. The TCI has recorded 86 cases of COVID-19 total, and unfortunately 2 of these persons have since passed away, and 21 persons in total have recovered. The public health team remains active in the field, testing on those in quarantine. Of the 74 new cases, 62% of the cases group predominantly affected are between the age of 25 and 44 years. Again, this group is the group that is of working age. Recoveries of COVID-19 positive individuals require 2 consecutive COVID-19 PCR tests, which would be negative, to be declared recovered. 2 persons remain hospitalized at this time, and although we have noted clusters of cases, there have been at least 26 cases which were unrelated to others. In many cases, there has been evidence of spread within households whereby family members within the same home have been tested and found to be positive. The fact that the number of cases have not been epidemiologically linked to others remains a concern, and persons who developed symptoms of COVID-19 are encouraged to contact the Ministry of Health through the hotlines for guidance and further advice. I will repeat the signs and symptoms of COVID-19 again so that persons are aware of what to look out for. The signs and symptoms can include fever, cough, shortness of breath, loss of the sense of taste or smell, diarrhea, and headache. If you have these symptoms and signs, please stay home and contact the health hotlines for advice on what to do next. If you're experiencing shortness of breath, please call 911 and provide the operator with as much information as possible so that the team who comes to you can be prepared to take the necessary precautions. This disease can easily be spread from person to person through droplets, which can enter the mouth or nose through contact with droplets or contaminated surfaces. The team continues to identify symptomatic persons through the health hotlines as well as through their contact tracing efforts. This is a time-consuming and difficult job, and at this time I would like to pause to both recognize and thank the team who has gone above and beyond in carrying out these activities in the interests of public health. It has required long days, nights, and weekends in the field. I would ask that everyone works with the teams in providing them with the information they need to carry out their activities and that persons comply with their directives. These directives are given with the express purpose of protecting public health. We have had issues with persons not disclosing information which would assist us in our investigations, and this in turn may increase the risk to the general public. We have also had persons who have been non-compliant with quarantine, which has also put others in the communities at unnecessary risk. You cannot look at the person next to you and say whether they have COVID-19. Therefore, we must all be vigilant and take precautions at all times. We have seen in the TCI that 62% of cases are asymptomatic. This means that these persons are not feeling unwell and may be coming into contact with others and potentially spreading the disease without knowing it. This is why measures such as wearing face coverings, frequent hand washing, and social distancing are so critical in stopping the spread of this disease. Every person in our communities needs to take these precautions seriously. Over the last 6 months, much progress has been made in strengthening the health sector to respond to the threat of COVID-19. This includes the recruitment of a number of staff, as the Minister would have alluded to, in the areas of compliance, port health, surveillance, assistant health surveillance officers, and medical officers within the Ministry of Health, as well as the Cuban contingent who are engaged by the government to support the hospital. The Ministry of Health has also developed a number of guidelines and protocols for businesses and tour operators, as well as guidelines for the cleaning of various premises, which can be located on the Ministry's website. These guidelines are for the purposes of keeping the general public safe in various settings. The different sectors were consulted when these guidelines were developed and are fully aware of them. The general public is reminded that COVID-19 continues to be an ongoing threat, and now with the reopening of the borders, we must all be even more vigilant. With the reopening of travel between the islands of Granta, South Caicos, North and Middle Caicos, as well as Salt Key, must be prepared. These islands have largely been spared from the experience of having known cases of COVID-19, and it would only be natural for persons on these islands to feel safe as they go about their lives in a more relaxed manner. Although many measures have been introduced to protect COVID-19 is an our families and communities safe. I would also strongly advise persons to consider whether they really need to travel locally, regionally, or internationally. Again, it is not business as usual for any country. Travel should only be undertaken if strictly necessary, and the relevant guidelines and requirements should be extended during your travel and arrival in a different area. The time when we could all pick up and go to Miami for a few days shopping has passed. Now each person needs to weigh the risks, the requirements, and the measures to decide if the trip is really worth it. We all need to live with COVID-19 for the foreseeable future and adapt to the new norm in how we go about our daily lives. In everything we do, we have to think about COVID-19 and the measures which the Ministry of Health has recommended in order to keep you safe. The use of face coverings, maintaining social distancing of 6 feet between persons, regular hand washing and sanitization, covering of coughs and sneezes, and calling the health hotlines if you are symptomatic are the keys to keeping ourselves safe. The Ministry of Health needs the full cooperation of each member of our communities in order to keep the TCI safe. Each person plays a critical role in our success in this fight. We are in this fight for the long haul, and we should all be prepared to play our part in order to protect those who are the most vulnerable among us and in our society in general. I would also encourage persons to report others who are not being compliant, whether it's individuals or businesses who are not being compliant with the guidelines. Everyone is reminded to contact the health hotlines 333-0911 or 232-9444 if you are experiencing any symptoms and signs of COVID COVID-19 or if you suspect that you've been in contact with someone who may have the disease. Please also visit the Ministry of Health's website for additional information or the Health Promotion and Advocacy Facebook page. Thank you.
Good morning. From an environmental health standpoint of view, we have been conducting a number of inspections over the last couple of months and recent weeks to ensure that persons and businesses are adhering to the protocols that we have established. Throughout businesses, non-food retail and wholesale, salons, medical places, as well as daycare and schools and past companies. And we also have others that were also inspected. We have also been working in providing guidelines on port health, which includes the Providenciales International Airport and our marinas, especially for the opening of the country today. When you come in to the country, as Minister and Dr. Astwood has alluded to, you will see a number of changes that have taken place at the airport. From the time you arrive off of the plane, you will see dots or markers indicating where you should walk or where you should stand to allude to social distancing and importance of washing your hands as well as wearing your face mask. At all times when in public. We also, when you come in the arrival hall at the airport, will be done by the public health nurses, and this includes temperature checks and other questions on that health questionnaire that each passenger is required to fill out prior to disembarking the aircraft. Once you move on from there, you will be directed to immigration, customs, and then on the outside, there is no gathering at all on the outside of the Providenciales International Airport any longer. All of this is to help in preventing and containing COVID-19 here in the Turks and Caicos Islands. The Environmental Health and the Ministry of Health, as Minister alluded to and stated, has been working around the clock to ensure that protocols are in place. We cannot stress enough that we have the protocols in place, but you, the residents of the Turks and Caicos Islands and visitors, have to adhere to the protocols that are in place to prevent and contain COVID-19. That is the only way we are going to be successful in eliminating COVID-19 here in the Turks and Caicos and seeing our numbers decrease. We are currently in an outbreak, and why? It's because persons are not adhering to those protocols, and we need persons to adhere to those protocols that we have on the government website. That is, again, hand washing, social distancing, and wearing a face mask or face covering. For those persons who experience symptoms, should call the health hotline. The health hotline is a 24-hour hotline, and the numbers were given, but I'll repeat it: 333-0911 and 232-9444. If you have those persons who have not, who as businesses have not been inspected, you will need to contact the Environmental Health Department submit your COVID plan to the Environmental Health Department, and the email address that you can submit your .tc and kkneely@gov.tc for us to review, and we will call you to conduct an inspection once we have reviewed your plans. If your plans were not submitted, that means your establishment was not inspected by our department. So we are urging those businesses to please reach out to the department and have their premises inspected prior to opening. Thank you.
Thank you very much. I would now invite one or two questions we'll take before we close our press conference. If you have any questions from the media. One question? Yeah. Testing. And given the inventory that Turks and Caicos does have, I think Minister, you told me it was like over 19,000 tests at the time that we spoke, maybe. Without more widespread community testing, maybe even to ensure that frontline workers like hoteliers in the tourism industry were tested prior to the reopening of tourism.
Thank you for the question. The gold standard testing is the testing that we incorporate here in the Turks and Caicos. It's PCR testing, which is polymerase chain reaction testing. It is the form of testing that is recommended by the World Health Organization. It is a very complex procedure to do testing. It wasn't a test that was previously available in the TCI, and thanks to the support of PHE, we were able to implement testing. We are currently working on increasing our capacity in the lab to do testing. We also have a testing strategy, and the testing strategy prioritizes who should be tested based on the number of tests that we can do each day. And those would include people who are suspected of having COVID, so those who have symptoms, those persons who may be referred overseas as emergencies through the treatment abroad program, as well as persons who are contacts of persons who are known to be positive. Following that, we also have persons that we must release from quarantine. So whether we have returning residents or persons who are placed in quarantine as a result of contact tracing, they are required to be tested prior to their release from quarantine. So each person would have to have 2 negative tests if they tested positive. So as you can imagine, the numbers have been quite significant, and this has been time consuming for the lab. Our testing strategy did incorporate would be to identify positive cases to ensure that we can implement the public health measures to prevent spread. With that said, we have additional staff who have been employed at the National Public Health Lab. We have received additional equipment from Public Health England with additional items arriving today as well. And with that equipment and additional staffing, we intend to increase our capacity to test. We are also in the process of ordering additional equipment, which will see us implement some automation into our testing for extraction, which is a very time-consuming manual process. And so we hope to have that here within the next few weeks. The challenge has been really that everybody is competing for the same supplies, the same equipment, the same consumables. So we have had to wait our turn. We have been agitating to get all of the relevant equipment and supplies to really increase our capacity. So we are hoping over the coming weeks that we will be able to increase our testing capacity. And of course, frontline workers remain a priority area. And so as the current situation in Providenciales, evolves and the outbreak is prioritized, frontline worker testing will be incorporated, because we recognized from months ago that that would be a really critical part of our success in the Turks and Caicos, is to be able to test people. So we are pleased that we have conducted so far over 900 tests locally. You would appreciate that before we had to send samples overseas. It would take us sometimes more than a week to get a result, and calling daily, WhatsApping. And so we are very proud of the lab and the work that they have done to get us to where we are, and we still have a way to go, and we are working diligently to increase the capacity of the lab.
Appreciate that. Where's the lab located? What is the daily capacity? Because we saw that in some testing, some days it was reported that it was 0 testing. Other days it was as high as 47, maybe a bit more.
Mm-hmm.
So, and when you give us those figures in these daily updates, are we also including the second test for people that we're taking out of quarantine and isolation?
Well, I think we have a number of reports that break down the daily testing. We do testing for lots of different reasons. The lab can only test what they receive. So we have been working through the samples that are collected in the field by the team that are doing the contact tracing. The team is also responding to calls through the hotline, and that's where some of the testing originates. If we find positive people in the field, we have to contact trace them. Each person might generate 10, 15 contacts, and they all need to be tested. So the number will fluctuate, but now what we're planning to do is to reignite the screening of frontline workers so that we are always able to work at capacity. We are training our additional staff in the lab to increase their capacity to assist. It's really been 1 or 2 people doing all of the testing. So we are now working with them to ensure that they are competent on the different machines. We've had a new staff member join the team, and so she's come up to speed very quickly. And so we're constantly working at new ways to increase the efficiency at the lab, how the layout is, how we have multiple systems working at the same time.
But still, what is the capacity?
I would say it's about between 30 and 40 per day, but we are working to increase that. I think next week our capacity will be increased further. And as I said, this is a priority area for the Ministry of Health, so we want to ensure that the testing is done correctly and that the results that we are giving are accurate. We wouldn't want to push the staff to produce something that we wouldn't be happy to sign our names to. So we have been working closely with Public Health England. We have been doing ongoing training with the staff to ensure their ability to do the testing, and we don't want to push them. It's a very manual and labor intensive, so we have to ensure that every step of the procedures are carried out accurately and correctly.
I don't want to belabor, but I did ask something that wasn't answered as well. Where's the lab?
It is Town Centre Mall.
Okay.
Yes, thank you.
Good morning, everyone. There's a message that just came through to us. Countries where you do not need to have a COVID test to enter. To also inform the other destinations that are coming into the Turks and Caicos that they have to have a test prior to arriving in the TCI.
Well, I believe that's the Ministry of Tourism. We have a TCI assured portal, which is where persons who wish to travel to the Turks and Caicos must apply. The website would have information in terms of the requirements. These are legal requirements that people need to meet in order to travel to Turks and Caicos. So the Minister would have spoken about the requirement for having a COVID-19 PCR test 5 days prior to travel. That result has to be uploaded to the website. There are other requirements that are, and instructions that are on there. Persons who are able to meet all the requirements are given the TCI assured approval, and once they have that approval, they can travel to the Turks and Caicos. That here has international reach in terms of the requirements, and a lot of countries have implemented this as a measure to safeguard their population. So I think that's an unfortunate incident. It's being communicated to the airlines, the requirements for coming to the TCI. All the stakeholders in tourism are very well aware of this. It's been something that has been discussed, a lot over the last few weeks and debated in terms of how best we can protect this destination from COVID-19. So that's my answer.
Okay. Thank you, Dr. Nadia. Talk to me about I call them COVID fugitives. What went wrong there?
You know, I don't want to get into too many specifics, but you know, the law requires that people who are served a quarantine order have a legal obligation to remain quarantined. They would be served with a physical order which outlines their legal responsibility under the various ordinances to remain in place, that they should not go anywhere. This is explained to them by the team at the time that they are interviewed, and it's thoroughly explained to them, and they are actually required to sign this. So unfortunately, we had instances where persons were non-compliant. As I said when I spoke earlier, people have not been honest with the team, down to not providing their true addresses, their true names, and this has made it very challenging for the Ministry of Health. There are legal remedies, so they were used by the Ministry of Health in getting an order signed by the Justice of the Peace, which is a legal document, which requires those persons to remain in place, and that's why we were